Hi, all. Thank you so much to those who are joining today's webinar. I'm really looking forward to the discussion and sharing details about the newly released Active Design Guidelines 2.0, also known as ADG 2.0, with all of you today. We have a lot to cover, so I know we're just at the top of the hour, but I am going to jump in. And I want to start by introducing our panelists. And after I introduce each individual, I'll be asking them to share what they're most looking forward to discussing during today's conversation. First up, we have Margaret Castillo. She's the chief architect of the New York City Department of Design and Construction, DDC. In this role, she ensures that design and construction excellence principles, including growth, equity, sustainability, resilience, and healthy living, are integrated into all DDC projects, spanning public buildings and infrastructure across more than 26 different sponsor agencies. Margaret served as president of the New York chapter of the American Institute of Architects in 2011 and as president of AIA New York State in 2016. Margaret, in 1 to 2 sentences, I would love if you could please share with us what you're most looking forward to discussing during today's conversation.
Uh, Thank you, Sarah. Well, I think you did a great job bringing the key people to this conversation because this initiative, Active Design 2.0, is really a cross-cutting across all of our agencies. So we have Center for Active Design that did the research. We have the Health Department that vetted the research. DDC can implement it, hopefully across our agencies. And probably most important, we have a practitioner uh, who really knows how to design with health, and that's what we're talking about.
Perfect. Thank you, Margaret. And then next we have Josh Langham, who is the director of the Active Design Program in the Center for Health Equity and Community Wellness with the New York City Department of Health and Mental Hygiene. Josh was truly the mastermind behind ADG 2.0. His work focuses on increasing opportunities for physical activity and overall health through the design of the built environment. Through multi-agency and cross-disciplinary projects, he implements active design strategies um, across the built environment. Josh holds a degree in landscape architecture from the University of Wisconsin-Madison and a master's degree in urban planning from the Wagner School of Public Service at NYU. Now, Josh, same question for you. 1 to 2 sentences on what you're most looking forward to covering today.
Hey Sarah, thanks for having me. And ditto to what Margaret said. I think we're really excited just to share the new guidelines. It was a labor of love and patience because it took a very long time. But as Margaret said, and as you alluded to, this was really a cross-disciplinary, cross-agency effort. It took about 6 years. So we're really excited to share the new guidelines and also discuss how to operationalize them with Lissa on board here. So thanks for having me.
Perfect. Thanks, Josh. And finally, we're also joined by Lissa So, who is a founding partner at Marvel, where she leads a visionary approach to designing cultural, educational, and public spaces that empower the communities they serve. Her work addresses both local and global challenges of building community engagement and collective action through thoughtful, collaborative design. Under her leadership, Marvel has grown to 150 people with offices in New York, Richmond, San Juan, and Barcelona, and was honored with the 2024 AIA-NY Medal of Honor and the Architects Newspaper's 2023 Best of Practice XL Firm. Lissa holds a degree in architecture from RPI. And Lissa, to wrap us up with our intros, please share 1 to 2 sentences on what you're most looking forward to discussing.
Well, I share the sentiment. I'm really looking forward to hearing Margaret and Joss talk about all the amazing work that they've done. And I'm excited to share some of the work that we've done that, these guidelines have really impacted our work and the decisions that we make. And I think, if there's one takeaway that I hope everybody gets today is that even the smallest decisions that we're making as we're designing projects can have such a huge impact when it comes to health and wellness.
Perfect. A big thank you to our panelists. I share the sentiment that I'm very excited to have this crew on board to have today's discussion. So to keep us moving, we'll be diving into 4 themes today, all centered around the newly released Active Design Guidelines, exploring how we got here, some examples of optimal implementation, what this looks like for New York City and how the principles can be applied outside of the 5 boroughs, and then wrapping up with a conversation about how this framework addresses some of the critical issues of our time before jumping into the audience Q&A. On that note, if you do have questions throughout the presentation, please type those into the Q&A box, which you can access under More if you're not already seeing it at the bottom of your Zoom screen. For those who are new to us, I just want to give a quick look at who we are at the Center for Active Design, also known as CFAD. The connection between public health and the built environment has driven progress in New York City for over a century, from Central Park to the Tenement Act, both designed to really create a more livable city. Mayor Bloomberg carried that torch forward with the Active Design program, focused on addressing the rise in chronic conditions like diabetes and cardiovascular disease, while also revitalizing the city post 9/11. That work led to the production of the original active design guidelines, which is a framework for translating public health evidence into actionable solutions for built environment practitioners. And ultimately, this led to the founding of the Center for Active Design, which is a nonprofit committed to translating public health evidence into design and operational tactics that foster healthy and engaged communities, ultimately focused on driving market transformation across the built environment in New York City and beyond. In 2017, we scaled this effort further by launching Fitwell, which is a globally recognized healthy building certification, originally developed by the US Centers for Disease Control and the General Services Administration, which CFAD ultimately brought to market. Since then, Fitwell has been applied by across more than 7,000 built environment projects, meaningfully reshaping the environments that we live, play, and socialize and work in. And then to wrap us up, for those I haven't met, I'm Sarah Carrera. I'm the managing director of CFAD. I focus really on the successful implementation of our programming at the Center for Active Design, whether certifying Fitwell projects, conducting original research around exploring the connection between the health interventions and value creation in the built environment, or collaborating with partners like New York City Department of Health and Mental Hygiene and the Department of Design and Construction to develop frameworks and programs that bring together public health and the built environment. And so, with that introduction, I'd like to now jump into the questions we have for our panelists, who will start by giving us some background on the new version of the Active Design Guidelines that we're here to discuss today. So, to kick us off, Margaret and Josh, let's start at the beginning. It's been 15 years, hard to believe, since the original active design guidelines came out in 2010. So I guess 16 now. Together, could you please give a brief background on what we mean when we say active design and the core areas addressed in ADG 2.0?
Yeah, great. Thank you, Sarah. I'll kick us off and then I'll toss it over to Margaret. So as Sarah mentioned, the original guidelines were published in 2010, a long time ago. And, again, they were really focused on the promotion of physical activity through the design of the built environment, design of our buildings and neighborhoods. And at the time, they were really an innovative, again, multidisciplinary, multi-sector document that were really grounded in evidence. It was one of the first documents to sort of really solidify the connection between the design of the built environment and its impact on health. They had a global reach and influence. Many other cities have sort of replicated the active design guidelines. But as mentioned, it's been 16 years. And so the evidence has changed since then. Next slide. So in around 2018, 2019, we really sort of took a hard look at the evidence and the research base again. And it was work started between the Center for Active Design and DDC, really started to dive into, so what else does the built environment impact? And, we partnered with CFAD and our partner agencies again to really dive into that research. And what it was pointing us to is that health is really the design of the built environment impacts much more than just physical activity. And there's really these interconnected health outcomes between mental, social, and physical health. Next slide. And also we wanted to look at how we can operate within this public health framework or the social determinants of health. So the conditions in which people are born, live, work, and play and age all contribute to health outcomes and are sort of shaped by the policies around us. So, as a city, we have control over some of the institutional sort of environment we're playing in, as well as the policy aspect here. So for, of course, the purpose of the ADGs, we're really focused on this built environment part of the pie here. So things about land uses, or access to public spaces, climate, transportation, housing, and of course, sort of environmental justice issues. Next slide. And so what the research was really telling us is that, again, those interconnected health outcomes can sort of be categorized into these elements that are really part of our environment, part of our built environment. So the biggest area of research the new area of research that we really saw was sort of this enhanced connections to nature. So things like access to park space, views of trees, those types of things. User comfort, how safe and comfortable someone feels in public space, not only in buildings, but also outside in our public realm. Inclusive design strategies, how does someone feel comfortable? Preserving and celebrating community identity. So how does one feel connected to their space? Does the design of the environment, does the inside, does the artwork, does the visuals around the neighborhood really feel like it belongs to them? Do they have agency over what happens in their neighborhoods? Creating high quality spaces, so things like maintenance. Does the place look nice? Does it feel like it's well kept? Do people sort of have sort of aesthetic sort of draw to some of these spots as well? And then perceptions of safety, of course. This can be, even if crime, the stats aren't showing us crime is here, the perception of crime being present can impact people's ability to access these spaces or willingness to access spaces. Next slide. So, we undertook this, let's see, 6-year process to get this going. But we really did come up with a great document that we're really proud of. And so I'm just going to go over quickly sort of the elements of the document itself. So, we start off with the introduction, where the document is really framed around 3 core elements of designing healthy cities: community collaboration, which we'll talk about a little bit later throughout the discussion; neighborhood design, streets, parks, public spaces, all of those types of things. And then, of course, building design as well. The intro really sort of defines what health equity is in the context of the built environment, emphasizing the importance of centering communities in our design process and how we're designing our spaces. And it also, this intro chapter really a call to action to bring a health equity lens to all the built environment projects that we're undertaking. Next slide. And then, as I mentioned, community collaboration. This was, again, sort of a big area of sort of a health-based research for the new document, that involving community in decision-making not only can make the projects more successful overall, but also can bring about some health impacts, sense of belonging, sense of agency, mental health, social connections, and all those types of things. So chapter 2, has evidence-informed design guidelines to help you think about your process of your projects. And again, there's multiple health benefits to the community collaboration chapter: mental health, social supports, and that sense of community. So now we'll kick it over to Margaret to talk about chapter 3 and 4.
Hey, thanks, Josh. The neighborhoods chapter, DDC does a lot of work for DOT, DEP, and parks. So this chapter has 12 evidence-informed guidelines to increase access to public space that's high quality and attractive. I think during the pandemic, we saw how important public space is, and this photo of 34th Street, open streets, really goes to the heart of our streets could be thought of in a different way. How do we support people physically, mentally, and socially, bringing people together? Next. And the buildings chapter also has evidence-informed guidelines to support health and well-being. This example project here of a library has the example of the original guidelines, which is increased physical activity through an open, inviting stare. But as Josh talked about, the mental health, having daylight, access to views of nature. And in addition, this library has a garden on the corner of the street to bring community together in a safe, open space. And we'll talk about more as we move on.
Yeah,
Thanks.
and I'll just add that we intend this document to be useful to our city agency partners, to all the architects and designers, and of course it's sort of centered in New York City, but we'll talk about this later. But it can be applicable anywhere, we really think.
Thank you guys for sort of setting the stage here. And I think what really strikes me about this set of guidelines are two things. One is sort of the scope and the expansion to sort of reflect that holistic view of what we mean when we talk about health. And then the second is that thread of bringing in that evidence-informed approach throughout every single section, including the community collaboration. How can we really use the evidence that's out there to establish a document and a process for what works and what can be effective. So I want to now turn it to Lissa. As somebody who designs buildings and spaces day to day, how do you address the connection between health and design in your work on a daily basis?
Yeah, thanks, Sarah. I mean, so Marvel, we're a multidisciplinary practice. We're architects, we're landscape architects, planners, urban designers, interior designers. And so we're really making sure that we're thinking about what's been put forward in these guidelines throughout the design of our projects from beginning to the end. And it isn't, that we're really thinking about them holistically, and then really embedding them into the concepts of our projects. And we would like to think about them kind of in three scales. We think about them kind of at the human scale, how people are moving through spaces, how they're feeling as they're moving through spaces. Are they feeling safe? Is it a space that makes them feel calm? We also think about them at the building scale, thinking about the opportunities of bringing natural light into spaces, maximizing the connection to nature. I mean, because again, as we're architects, but landscape architects too, a lot of our projects have that integration of really having that connection to nature. And then we also think holistically about that community scale or city scale. Big part of our practice is about we do community engagement on most of our projects. It's really a big part of how we design our work. And we start each project by listening, like really learning what each community wants, because you can go into a project and kind of make assumptions about what you think might work, but until you really speak with the community and understand what is right for the users that are going to be in this public space or this building, it's not until then that you really have a sense of what is right for a project.
Yeah, no, and that's really great to hear and sort of see reflected in the guidelines that human scale, building scale, and community scale. Sort of the connection between what you're saying and what is laid out in the active design guidelines sort of shows the power of that interdisciplinary approach where we're bringing together both the public health side of things and the practitioners to make sure that what we're developing is actually landing and makes sense for the industry. So that's super helpful. And now to sort of jump a little bit deeper into what these guidelines look like in action and what it looks like when we think about the implementation, I'm going to stay with you, Lissa, here for a little bit. If you could sort of walk us through a recent project where you've applied active design principles, what did you actually do, and what made you decide to take that approach and drove you towards that thinking?
Yeah, so I wanted to share about a project that we completed a couple of years ago, the Northeast Bronx YMCA. This is a project that was to be built on city-owned land, and it's an area of the Bronx that's a pretty underserved area with not a lot of green space. But the site that we were given, it was kind of an abandoned site that there were a lot of overgrown trees. And a lot of trash also on the site. But we really saw the potential and the beauty of the landscape that existed there. And we were to put a recreation center, a gym, a pool, a wellness center. And what we really wanted to do was try and integrate it into the landscape. So if you go to the next slide, you can kind of see our initial concept sketch. The image on the right is a view of the site before we as when we first engaged the site. And the sketch on the left was the idea that we would try and map all of the existing trees and try and save as many of the large trees that we could. And that we would nestle these pavilions, a gym pavilion, a pool pavilion, a wellness pavilion within those trees, so that we could create a space that felt like it was truly connected to nature. And so if you go to the next slide, it shows this kind of beautiful glass corridor that connects. This is right when you come into the space. You come into the wellness pavilion. You can see the gym on the left, and the pool is down at the end on the right. And I think we had a couple really wonderful moments after we built this project where we had gone through and done kind of post-occupancy conversations and surveys. And there was a lifeguard that had been working there for maybe about 6 months. And he said, and we asked him how are you liking the space? And he just said, I think the best thing about this building is that it it almost doesn't feel like a building. You almost can't tell the difference between the inside and the outside. And that was like, it was such a rewarding moment I felt. And then in that same day, we were in the gym and there was a young teen who lived in the Eden houses just across the street. And he said, we asked, how are you liking the space? And he said, I really enjoy coming here because it makes me feel calm. And this kind of 12-year-old boy who, you could tell that the way that the space had been designed and the design decisions that we had made had really impacted this child's life. And in that moment, we really felt the power of like those small decisions that you make in creating a project can have really big impacts on people's lives.
Yeah, and I mean, it's always so amazing seeing these pockets of green space that really are optimized within the city and what a power that can have, just given sometimes the contrast that has to the rest of the city and to other spaces. So this is, I mean, it's beautiful space and really amazing to see some of that in practice. Kind of continuing on this theme of actual implementation. Margaret, curious if you could speak to some city projects where you've seen these guidelines be implemented successfully.
Yeah. Um, so I know these are small images, but this is sort of a peek inside the guidelines. And figured we have to show you images of what we mean when we say health in many contexts. So on the left, a community garden, still going back to the first Plan YC of a garden or an outdoor space within 10 minutes of every citizen, I think is, if we could do that, it would be a wonderful thing. So, it doesn't have to be big, it doesn't have to be Central Park, just pocket parks, little community gardens. In the middle on the top, hopefully we will keep the DOT Plaza program because it has offered all sorts of spaces for people to gather and hang out. And taking over slip lanes, and there's always a discussion about that. But it shows the benefit of having more beautiful landscaped public space. The upper right, that's actually Astor Triangle. It shows how much people crave open space. You're actually an island in the middle of traffic, but everyone wants to hang out there. And I'm glad, Lisa, you mentioned youth because the lower right is to show how we should be thinking about public space and neighborhoods for all people. And I would say particularly youth. We do want to keep them busy, active, and have fun places to be. The middle bottom is one of our bike lanes that has the attributes of also trees and rain gardens and safe spaces for the bicycles. So that's sort of a peek at the neighborhood chapter. And next we have some examples of the building chapter. So I think Josh mentioned environmental considerations. So the picture on the on the right is a library that was windowless, low ceiling, and the architects found a way to bring natural light into the space and also addressed acoustics, which sometimes is really hard to picture it, but we know it when we are in the space, what a difference it makes. The lower photograph in the middle is a health center. So part of this has to these guidelines talk about mental health and well-being, and using principles of biophilia that wood and natural materials also can reduce stress. So a health center, which has people, both the patrons and the staff, can be stressful. This example was a great example. Plus, they brought in natural light into a stair in view of a garden. On the left bottom is a library that shows how we think about public buildings and social spaces, not just at a fixed time, but over time in the course of a day, how building flexibility allows kids to hang out during the day, and maybe elder folks in the morning. And lastly, one of my favorites is the upper left, which is a roof. And imagine if all the roofs of public building had fun, active spaces on top. This is the Brooklyn Children's Museum, where they have the most amazing program, joyous children, active, view of nature. It has everything. And then last, I wanted to show something new that we've been doing. Again, I think you can't underestimate this issue of social health in this age. I mean, Vivek Murphy talks about an epidemic of social isolation. Any place to bring people together, every place to bring people together, either in public space or in buildings. And here we're showing it doesn't just have to be in a library. These are two recent police precincts. The 116 on the left shows the community room right off the plaza. Children are engaged in game night. They brought DJs. It just changes the conversation between officers and the community to have a space that's neutral, that's safe, that's accessible, not through the precinct. These are community rooms. And on the right is the community room for the 4.0 precinct, where you can see it has its own entrance. It has a magnificent artwork by Jeffrey Gibson, the artist, again, to bring people together to have a different conversation. And those are our two recent police precincts.
Yeah, super compelling. And I think what both you, Margaret, and Lissa have shared around sort of one, designing spaces for what the purpose of that space is, and really thinking intentionally about who's going to be using this space, and then also designing for many different populations to bring the community together and really make sure that multiple different groups' needs are being met, I think is a real kind of staple of urban development and kind of urban design needing to obviously our population in urban environments, it's dense. There's a lot of different types of people and different age groups across the life course needing to make sure that the spaces are really designed with that in mind and have that flexibility to be able to suit different groups' needs. So thank you so much for sharing these. These are beautiful. And then to wrap us up sort of in the section of implementation, Josh, I know that you all and your team have really been active in school environments, which is a big focus for the Department of Health. So I'm curious if you've seen in your work what some novel approaches are for integrating ADG principles into that school environment, really targeting youth.
Yeah, thanks, Sarah. Yeah, so we have an active design in schools program that we've had for quite some time now, and it's we've learned a lot. We've grown quite a bit over the years, but in especially in the New York City context, there's not a lot of space, and we have a lot of schools that don't have access to spaces for physical activity, either indoor or outdoor. So, we've really worked really closely with folks at the New York City public schools, with some local community-based organizations, with artists, and with architects and designers to really think creatively about how to utilize the space that these schools do have and sort of rethink how these can be used to promote physical activity and overall wellness. I think we sort of utilize the principles that are in the active design guidelines, especially about this community collaboration chapter and engagement chapter, to really engage students. We've engaged all the way from like preschool to high school students to really understand what their needs are, what they want to see in their school, and of course with the principals and the staff as well to really think about how we can activate these outdoor spaces through simple, low-cost things like ground murals, interactive wall murals, really simple things that can really get kids moving, can really activate the space in a lot of cool ways. Also, things like raised planter beds. How do we get kids outside? How do we get them digging in dirt, right? Like these are sort of low cost things that are really important. But I think what we've really learned and, we've adjusted our program is to the engagement part is really important. The collaboration part is really important, not only to get to the design to be implemented and to understand what, either through colors or shapes or sizes, but also how the space will be utilized, how it can be sustained over time, and that's been really important. So working with the teachers about their curriculum. How do you activate the school for outdoor learning environments? How do we get kids outside? How do we activate the street space next to you through the cities and or DOT's open space or open streets initiative? And we've seen a lot of success, right? Simple things like just furniture, right? We've done some observational evaluation studies. It changes things entirely, right? And an extra 20 minutes of physical activity for kids is really important, not only for their physical health, but their mental health as well. And so I think, we've been able to identify it doesn't have to be super expensive. Unfortunately, we're not building all new schools and we probably won't anytime soon. So how do we really utilize the space that we have to make it as efficient and health promoting as possible?
Yeah, I think that last point is a really, really great one. A lot of times we're working within the constraints of existing buildings, and that's a good thing in a lot of ways. It's a sustainable way to develop. We want to work with the resources that we have available. But it also presents challenges of how do we optimize these spaces and really think about the areas that we can integrate changes. So I think that's it's a good note that a lot of these buildings that we're talking about are not going to be built from the ground up. We're working with the infrastructure that we have access to. So I'm going to move us into thinking about, okay, so we're all sort of operating within the New York City context. Lissa definitely has some exposure outside of New York City. But one of the things that we did think about in developing these guidelines is how does this respond to New York, but then also how can these be applied outside of the five boroughs and outside of the city? So with that, I want to turn a question to Margaret. So New York City obviously has many unique challenges given its, density, global presence, resilience challenges. And I was curious, how were these challenges addressed in ADG 2.0, and what can other cities kind of take from this approach that we used?
Yes, you're right. Tremendous challenges. Starting with Superstorm Sandy, we had it was really a wake-up call about resiliency and the and our 520 miles of shoreline. And we're not alone. We've actually had conversations with Miami too. And so there's the Army Corps of Engineer approach, put up a wall, and then taking the active design principles. Um, yes, we do need protection, but how can it also be of benefit to the community? So for the East Side Coastal Resiliency Project, there was extensive community collaboration, and the result is building a park with things that we learned from the community. So bike paths, running, um, basketball, tennis, passive lawns for community to hang out and have a nice picnic overlooking the East River. So it's a project that I think, and I would hope that many city projects have this. It's not just solving a problem that's technical, it's also adding tremendous community benefit. And I would say it's through the lens of health that we're caring about the individual and the community um, at, uh, at the same time.
Yeah, I think that's a really good point too around the kind of co-benefits and really maximizing the impact through thinking about the challenges not just as kind of standalone, but how does it integrate with other opportunities to maximize the impact and really looking at what are the unique challenges within a space to address it. So thank you for that.
And
Uh,
Sarah, just to But it's interesting how we say the word co-benefits. If we center health in our community, one would say that's not a co-benefit. That is something that's critical that we do. I'm just, you know,
Yeah.
a big advocate for these guidelines.
Yeah, no, definitely, definitely. And centering, I think, alongside sustainability and how do we think about these things in tandem,
Yeah.
one another, I think is really, really important and really thinking about how do we message the magnitude of the impact when we're centering that health focus.
Yeah, exactly. And we added that climate and health sort of section in the intro just to sort of really visualize how these guidelines are really in line with sustainability goals, with climate resiliency goals. And you can also promote health at the same time, right? You just sort of have to think about it sort of from the beginning, and it sort of, further justifies the cause for doing these types of projects.
And I think that's 21st century design, honestly. We have to think about the planetary health at the same time that we're thinking about every individual in our city and their health. It's a big task, but that's sort of where we are now. We know we need to do this.
But you're right. It's yeah, I mean, it's central to human health is the planetary health. Obviously, these changes are what we need to be able to sustain. So I think that's really a great point. And Josh, so when we think about the ADG 2.0 playbook, how do you think other cities could apply these guidelines within their kind of areas they serve and focus on?
Yeah, I mean, again, we sort of are sort of focused on the New York City context, but the health needs of people are the same across the planet. Like New Yorkers aren't necessarily unique in that regard. And so I think everybody needs access to nature, everybody needs physical activity, everybody needs to feel safe and comfortable, everybody needs opportunities to socialize and feel connected to their communities. And I think these guidelines are widely applicable to all of those things. Safer streets, safer parks, all those things in these guidelines can really help you think about design strategies to promote those types of things. Maintenance, clean and healthy things, all things that, every person needs wherever, regardless of where they live. Um, Everybody spends about 90% of their time indoors, through work, through school, through just hanging out at home. So how are we designing our buildings to really make sure that we're maximizing the health benefits that buildings can afford? Access to daylight, quiet spaces where we can get a good night's rest, all those things. So noise mitigation, all those things. So it's widely applicable not only for New York City, but other cities across the U.S. and certainly across the world as well.
Yeah, no, and I think that definitely underscores too what we're seeing through certification programs like Fitwell. We know the kind of core tenets and the core elements that need to be integrated into our spaces to promote health. And then where it gets into sort of the differences that can exist within different jurisdictions is sort of what do you prioritize based off of the needs of your specific population? And then also, what are the kind of unique constraints or considerations of are you working with, an older building stock? Then what are the things that you need to think about? So then it really gets into the implementation and the things that Lissa really grapples with on a daily basis. And so with that, Lissa, I'm curious, what are some cities that you really see as leading the way when it comes to integrating the principles that were included within ADG 2.0, and what are some examples of those?
Yeah, I wanted to share with you. Well, first, I did want to say, Margaret, I am a Lower East Side resident. And so I have personally reaped the benefits of your work with the new park opening, this past summer. It was an incredible feat that project and has brought so much to my neighborhood. So thank you for that. But I wanted to share, we have been doing a lot of work out in Northwest Arkansas as part of the Walton Family Design Excellence Program. And so they're doing a lot of really interesting things out in both Fayetteville and Bentonville area. And we had the pleasure of building a performing arts space out there. It was along an arts corridor. So they're doing a number of things to make the cities more walkable. They have a number of hiking trails that are connected to the city. But along this arts corridor, I've really done a number of things to make the basically connections to the community. And so when we built this building, it has a 400-seat theater, it has a studio theater for about 200 people, and the volume that you're seeing here is a big rehearsal space that also serves as a community space. But really, the kind of really amazing part of this project is what we call the community living room. That is a living room that is basically open to everyone and feels like it is very welcoming space along this arts corridor. So if you go to the next slide, it's a space that, you're there before performances and after performances, but it's a space that you can come to any time of the day, meet a friend, have a cup of coffee. So it's just become this incredible resource for the community where, like I said, everybody feels welcome. And it isn't necessarily just about going to a show. It's about really serving the community and creating an identity for this community and for everybody to feel connected. And the next slide, you can see there's this wonderful stair that kind of has a view out to a park that's across the street. And so this stair serves as a place for kind of people to hang out and gather. They also do book readings here. So really thinking about how can we create spaces for that social interaction.
That's great. And I think that theme of, yeah, drawing people to a community center is so prevalent given the concerns we know about social isolation and social engagement. Very, very beautiful example. So I'm going to move us into our final kind of section before we jump into the Q&A from the audience. So in ADG, there's a kind of powerful, oops, sorry. There's a powerful quote around the disparities that we see across our neighborhood. So, Josh, we see that for New Yorkers, one zip code can really be a better predictor of health outcomes than genetic code. And I think that's a kind of theme that we see discussed frequently with the social determinants of health and sort of underscoring why this work is so vital. And so I was wondering if you could speak a little bit to how you see design being able to address that reality that we're seeing in New York.
Yeah, of course. And, that 14-year gap is sort of really unacceptable, right? And certainly avoidable. And your zip code should not determine sort of your life expectancy. And, we've rebounded quite a bit. And now in New York City overall, we're sort of at our highest life expectancy we've ever experienced. But there's still vast inequities and disparities between racial and ethnic groups as well. And then if you sort of overlay where those disparities and inequities are happening, you can sort of just pile on the poorer health outcomes, and they sort of concentrate in certain neighborhoods, right? And so again, sort of avoidable and unacceptable, and certainly something here at the health department we're really trying to tackle. And from the built environment standpoint, we can also look at those same neighborhoods and see that there's inequitable access to well-maintained and quality park space, oftentimes inequitable access to transit, inequitable access to services, and all those types of things, right? And so I think, one thing that ADG 2.0 is trying to advocate for is really sort of this equity lens to the design approach. How are we making sure that we're collaborating with communities and across agencies to really understand what the needs are of the communities, and then, invest in those neighborhoods in the appropriate and equitable way. Not all neighborhoods need the same types of things, right? So we really do have to take sort of this equity-focused approach to that. And it sort of starts with a design approach, a human-centered design approach. And I think, sort of we advocate for those things in the guidelines quite a bit.
Yeah, yeah. I think that is, again, that theme of really working with the community to understand what the needs are and creating context-specific applications of the themes that we know are important, I think is a really, really important lesson here. And then, so Lissa, when you're working in communities that have experienced disinvestment, how do you approach design differently? And what does equity really look like for you and for Marvel in practice?
Yeah, I wanted to share an example of a project that we're just about to complete. It's going to open up this summer, which is very exciting because it's been a long ongoing project for a number of years now. But we renovated the Orchard Beach Pavilion in the Bronx, And this is just a beloved place where you live in the city and you're able to access the beach, and there's a large Puerto Rican community that uses the Orchard Beach Pavilion. But and I mentioned this at the beginning, we really like to listen, that we feel like that design can empower the communities that we are working with by us engaging and really listening. And so on this project, and you go to the next slide, we did a series of engagement sessions, a large number of them, where we had kind of whole auditoriums filled. And we did a series of these boards where we asked a lot of questions, and we really wanted to hear what the community valued about the place as it existed now. How could it improve? What were the most important things on the project? And the feedback that we got really influenced the work that we did. And if you go to the next slide, we are restoring the pavilion, but we are really making it a space for everyone. And historically, how you entered the pavilion kind of through the center, and you kind of came to this amazing kind of view of the water, and then you would come down some stairs. But the only way you could access that was taking some stairs up to that platform and then taking some stairs down to go to the beach. And so what we've done is made the entire space accessible, and thinking about how people are going to move through the space and that everybody is going to be able to move in that way. And then also thinking about areas, different types of programs that will occupy the pavilion itself, as well as different types of shade, and that you would have different experiences as you're going to this pavilion. So I think this is a really great example of how engagement had a really big influence on some of the decisions that we made.
Yeah, yeah, that's great. And really designing for all populations to be able to use this in as they should and enjoy the asset that it offers. It's beautiful. And so to wrap us up, before we jump into the audience Q&A, Margaret, so ADG 2.0 has a new chapter on community collaboration, which I know we've sort of mentioned throughout today's conversation. And I was curious if you could share a little bit about why that was such an important addition and what does meaningful collaboration actually look like? What are we talking about when we talk about collaboration?
I think Lissa's right. It starts with listening of the community. It's interesting how it's taken different forms in different projects, which I guess is natural. But thinking about East Side Coastal Resiliency, so bringing them together, many charrettes over time with Bjork Ingles' team initially, and then it carried through. But one other thing we did with East Side was develop a resiliency curriculum for schools on the Lower East Side. And I thought this was kind of a brilliant way to do collaboration, because if we talk about resiliency and design for our young people, maybe they will grow up to be the citizens we need to think about health, both socially and planetary. And it was also an opportunity to introduce them to what architects, engineers, and contractors do and potential jobs, which I don't think they knew about. HPD did a different kind of community engagement in Brownsville. It lasted a whole year and it was quite in depth. And what was good about that one is they shared it with all the agencies. So you can imagine we're going into neighborhoods for many reasons, and we don't want engagement fatigue, but there is a way to do it where we share information. I'm actually looking forward to what is coming from the Mayor's Office of Mass Engagement and the Mayor's Office of Public Engagement Unit. And just lastly, the Climate Strong Communities has an approach that not only engages the residents, but also nonprofits, community organization, religious organizations. So it isn't a community, isn't just a one particular group. It's how do we take advantage of all the services that are there, which I think is another way to think about community engagement and the best way to do it. But I agree, listen first. It's their community.
Yeah, and that's a good point too about not recreating the wheel. Like if there's something that already exists, then tap into that and really leverage those resources. Is can be really, really powerful. And then just integrating into those systems, integrating into the schools and the other resources that are available, and communicating, really prioritizing communication and how the information is disseminated. So thank you all for today's conversation. I'm going to stop sharing the slides, and we're going to move into some questions from our attendees. So. The first question I want to start with is really about we've talked a lot about sort of the use side of things and making sure that the spaces are accounting for meeting the needs of that group. But we got a question of, is there any information about intergenerational design to ensure that design benefits not only the very young, but also the very old? I know aging in place is obviously a hot topic for us all. So anything that I'll open up to all panelists to sort of jump in here.
Yeah, I can start. Certainly, inclusive design approaches are integrated throughout the guidelines themselves, right? And so, how do we think about intergenerational spaces? Because, you that's not only good for physical health, right? Making sure that older adults and younger adults have places to be, but it's also good for mental health, right? And there's the research that supports those things, right? Older people, younger people interacting, even observing has sort of shown to have some mental health benefits, right? And that social connectedness and social belonging and all those types of things. So certainly, the guidelines have strategies that are, meant to be inclusive of all generations, all genders, all of those types of things.
Yeah, thank you for that. I think it's definitely making sure that we're designing throughout the life course is something that was top of mind in the research that we pulled. I think we focused a lot too on how the same space could serve multiple different groups. And I know we all love the curb cut example of sort of that was a real innovation where for those who were in wheelchairs, how do we make sure that our streets are accessible? And then we discover this is not only good for those in wheelchairs, but also those in strollers or those who maybe are suffering an injury in the moment. So it really shows that designing our spaces for target populations can have a really expansive impact.
Right. And just, piggyback on that, if we design these spaces, we also need to maintain them, right? Like we need to make sure that our sidewalks are smooth and free of cracks and unevenness and all those things for injury prevention and safety. And that also makes people feel more comfortable going outside and, increases use and all those things. So maintenance is also a new aspect of the guidelines and how important that is to think about that as part of the design process and sustainability afterwards.
Yeah.
Yeah, and that flexibility to accommodate all ages, I think of, like public spaces that you have a place in the shade that's comfortable seating, but maybe you're overlooking children playing, um, not too close, but there as a view. Um, I think is really important to have that, and then build in flexibilities in our public buildings um, to accommodate all sorts of groups, and bring in nonprofits in our community room, perhaps to also support communities.
Yeah. Perfect. And then another question that we got, which is a really, really great one. So, on challenges, what role do you think the architect and designers have in the health impact our designs have on the occupants? Would you please comment on how you think those responsibilities are reflected or not in the professional responsibilities of the architecture community? And sort of referenced similar to the Hippocratic Oath for doctors. And I'll turn this over to Lissa to kick us off here.
Yeah, no, I think it is very much our responsibility, and I think it's also a responsibility to help educate our clients. I think that, if we can help them understand that the decisions that we're making are going to help them create buildings or spaces that are going to perform better and that are going to, that it isn't just about, something that would be nice to have or that is a non-essential thing for a project to meet its budget or to work. But it really, these decisions that we're making that really have an impact on health have tangible, measurable outcomes, where it is really, for example, in a school, you can measure the ability for students to focus, because they're getting better natural light. It's easier to convince a client that this is a good thing to have, to do a larger window, because not just because it looks good, but because it's something that's going to really impact your students and their performance, um, you know, from performance perspective, also from an energy perspective. Yeah, so I do really believe that it is our responsibility, kind of in a similar way to other professionals like a doctor. Yeah.
Yes, I think it's in our profession, health, safety, and welfare. So here we
Yeah.
are. And that's where I think the guidelines also can help us here, because I'm not sure if you say, oh, but let's talk about health, and no, we need, so much square footage for this, that, and the other thing. But
Mhm.
I think also, along with schools, it's been proven in an office environment reduces absenteeism, happier to be at work. With a better environment. Of course, from a design excellence point of view, we think that too. Um, we showed examples of libraries, but when you think of the city's portfolio, we're also talking about unhoused people. We're talking about children's services. We're talking about juvenile justice. Um, it's important that their spaces have dignity and are as good as any other space, and the staff that work there. I mean, that's why I think these guidelines are really important to say, here is something that can reduce stress. We have so many wonderful professionals, working for the city that are under great deal of stress, from a police, fire, recent sanitation workers working 12 hours, children taking in foster children. I mean, and some people haven't seen that like as an important criteria when you're talking about programming. So that's why we're really happy with these guidelines.
Yeah, and I think, listen, Margaret, you make great points about sort of aligning stakeholder incentives and making sure and sort of demonstrating and showing how this isn't just a kind of nice to have. This is really integral to achieving the goals that diverse stakeholders have and making sure that the messaging is aligning with what those incentives, whether they're mission oriented or bottom line oriented, there is this convergence that can happen. And I think the active design guidelines really do a good job of showing that these tactics have those benefits for the different stakeholders. So thank you for sharing a little bit more about that. Um, I think we have time for one more. So I apologize. We're not going to get to all of the questions, but we will respond via email to those that we don't. Um, so a good question about how do panelists imagine that active design guidelines are integrated into micro neighborhood or neighborhood planning studies? So I think this gets a little bit into the evaluation efforts, understanding sort of how do we know the impact that these guidelines are having? So I'll turn that over to Josh because I know that's something that's on his mind.
Yeah, certainly. I think, the guidelines can be applicable to a planning approach, right? And that starts with the engagement approach, but also just having the knowledge of like what is important aspects of neighborhood design, right? And so the guidelines sort of speak to those. And I think they can also be used as a tool for community groups, right? To or residents or community-based organizations as an advocacy tool to present to city agencies as well. So we see this as a tool for practitioners, architects, city folks, but also on the community-based organization level too, right? Where residents can be like, okay, here's the things that we think we should have in our neighborhood. Here's how we think they should um, manifest, after the planning study is done and what we see in our built environment. From an evaluation standpoint, I think this is something that we're continually trying to work on, right? And like measuring health outcomes in a short period of time is really difficult, especially like from a disease approach or, from Chronic disease approaches, those timelines are quite a bit longer to see. But I think what we're trying to figure out is how to capture that qualitative aspect, right? How do we sort of measure sort of user satisfaction with the space initially? How do we sort of put an evaluation approach or a flexible time period where the project is built and we can go back and ask, is this meeting your needs, right? And be able to go back and make adjustments as needed. That'll take some time to do, to figure out how to institute that process on a citywide level, but that's what we're sort of hoping to do. The city has plenty of data. We have a lot of health data. We have all of these things that we can sort of use to help us make the case for this, but I think we have to do a better job of actually talking with community members on an ongoing basis, not just at the beginning of the project, but also at the end of the project as well.
Beautiful. Well, thank you, each of you, for kind of sharing your unique perspective on this conversation of the active design guidelines. We're really thrilled that these are out and in the wild and excited to see how people start to use them and apply them in their work. We'll be following up with all of the attendees with a link to the webinar so that you can share it with any of your colleagues who you think would be interested. And that will also include a link to the active design guidelines in case you haven't fully dug in yet. But really appreciate today's conversation. And it was a lot of fun. So thank you guys for joining today.
Thank
Thank
you,
you so
Sarah.
much.
Bye. Have a good rest
Bye.
of your week.
Bye, everyone.
Bye.